informational DVD is providing comfort and helping women face their fears. It's titled Breast Reconstruction. Know Your Options, a guide for the woman with breast cancer. Please welcome the creator of the DVD, Dr. David Morwood, and its host, Dina Eastwood. I just got to say hi, because Dina and I go way back. We used to work together in Salinas.
She's the greatest reporter in the newsroom.
You were awesome. You were fabulous. You were just such a role model and a mentor, just a fabulous person in general.
Thank you. Right back at you.
And I'm just so happy and pleased to see you're involved with this. Let's talk about this DVD. Why did this come about? How did it come about?
Well, the message we want to deliver to women is that if she is diagnosed with breast cancer, she no longer has to choose between saving her life and saving her breast. She can choose to have both. And that's so different than the way we used to treat breast cancer, where a woman would go to the operating room with a breast lump, not even knowing whether or not she had breast cancer, and she didn't even know whether or not she would wake up with a breast, and there was no discussion at all about breast reconstruction. Well, if we fast forward to today, in Monterey and in other breast centers, we can pass a very fine needle through the skin into the lump, take out some cells, and then talk with the woman about the result. And we can involve the plastic surgeon, of course, at the very onset, and we can talk with the radiation doctor, we can talk with the chemotherapist, we can talk with the cancer surgeon, and we can put together a custom-designed surgical approach just for that woman.
Okay, Dina, you have a friend who's actually gone through this, who's a patient of Dr. Morwood. So tell us about the mind frame about, possible disfigurement. I mean, what does a woman go through?
I will tell you, I think that it's rare for guys to see body parts, but you know how we gals are always like showing everything. And I've had the pleasure of seeing his work firsthand. She did have a mastectomy. She had a reconstruction. It looks amazing. I'd never seen her wear a low-cut shirt before she had the reconstruction. So the options now are so very different. And she was very open with it, and she's kind of a closed person. But that's how I became more of an admirer of Dr. Morwood, whom I've known for years locally. But when he asked me to come on board with this project, I was thrilled to do it because of our friend. And I think every one of us have at least one or two people in our immediate lives or families who have this disease. And statistics say that if you don't now, you will.
You will.
No matter what, you will.
My sister who had it, and then one of my best friends, and I was just talking to the doctor about that before, because she's getting ready. She's had her chemo, she's had her radiation, so 1 year after the radiation, it's now about reconstruction and what the options are there. And there are some options.
Right, so you're raising a very important point. There's a number of things, or a number of lessons we want women to learn. First of all, they can choose the type of breast reconstruction. And I think most women are familiar with silicone breast implants or saline breast implants. That's one way to do breast reconstruction. Another way to do breast reconstruction that more and more women are choosing is what they call the natural tissue way of doing breast reconstruction, where we can do sort of a tummy tuck, and instead of discarding that tissue, we actually use that tissue from the abdomen or tummy to reconstruct the breast. And more women are choosing that option.
So are these examples of the different, I don't know the difference, so can you describe to me?
Right, so we've gotten to the point where some of the same breast implants that we use for cosmetic breast augmentation, we can use for breast reconstruction.
And it looks just like as it did before? I mean, you can make breasts look just as same size, very similar.
So what about the nipples?
Okay, so to reconstruct the nipple, we can use the woman's own tissue to do that, the nipple and the areola. The areola is what plastic surgeons call the tan part around the nipple. And a lot of women, we call that the icing on the cake, that they go through the breast reconstruction, and that's the final step. And then they find it very rewarding.
You know, when you were talking about the natural way of doing it, that's great because you get a tummy tuck. So if you've had children, you kind of get rid of the mummy tummy at the same time. If you don't have enough fat there, there's still another option, isn't there?
Right. There's another way where we can take the latissimus muscle, you know, the weightlifters call it the lats, and we can take the skin and fat overlying that tissue, transpose it forward to rebuild the breast, and sometimes we do that in combination with a breast implant as well.
Are there any concerns about doing this or having
scarring?
Yeah, or that's probably normal, but any side effects or?
Well, you know, our biggest concern, and why Dina was willing to help us with this DVD, is there are a lot of decisions for women to make. And I totally understand this. I see this time and time again in the office. They feel overwhelmed. Well, what we have done, I think, successfully with the DVD, when a woman becomes educated and learns her options, she can actually become empowered to make choices and feel whole again.
Right.
And that's our goal.
It's like having that information is very helpful. I mean, what do you hope people take away from this, Dina, this DVD?
I would hope, and I've gotten this from Dr. Morwood, you freeze, evidently, when you get your diagnosis, and we want to be the anti-freeze. We want it to be where women freeze later. Get educated now, freeze later. And I know that all the emotional knockdown does hit you, and that's obvious. But his goal and our goal together is for women to have every choice possible before they go into the operating room. You will have little scars, but the scars are so fine these days.
It's a great
amazing
idea.
Yeah, so where can you get this DVD?
So for the over 200,000 women in the next 12 months that will be diagnosed in this country alone, they can go to our website. It's called breastreconstructiondvd.com. They can see Dina's introduction. There's a 10-minute summary. It's free all over the world, breastreconstructiondvd.com. And if they want more information, they can get the DVD.
Okay.
That's a wonderful thing.
Thank you so much.
Thank you so much.
Thank you so much for coming all the way up here.
Thank you so much.
Great to see you.
Thank you. Yeah, great to see you, too.